Good morning, everybody. Today we gather to celebrate the award of almost $1 million, $970,000 in grant funding to family guidance centers to establish and operate a mobile overdose prevention outreach van. Special thanks go to Commissioner Monica Gordon for her work on this initiative. Thank you, Commissioner. And for being a tireless champion for our most vulnerable communities. Can someone get her a glass of water, please? I would also like to acknowledge Tashala Ross, representing Commissioner Deere's office, Ron Velacity, did I do it right?
Yes, ma'am.
Ron Velacity, Chief Operating Officer for Family Guidance Centers, Dr. Thomas Nutter, Chief Behavioral Health Officer for Cook County Health, 2 days in a row with Dr. Nutter, and Michael Ferguson, Program Manager of Family Guidance Centers. I also want to acknowledge Alderman Mosley from the 21st Ward who's joined us. Thank you, Alderman. And I would be remiss if I didn't acknowledge in our audience former Commissioner, would you stand up, please? Deborah Sims, who represented this community with distinction for how many years? 28. Almost 30 years, almost 30 years. The funding for this project was made possible through Cook County's allocation of American Rescue Plan Act dollars. The American Rescue Plan Act allows us to invest in the residents of Cook County, and we thank President Biden and Congress so much for this support. Now, needless to say, we've got a real challenge across our country with overdose deaths. And for the last several years in Cook County, 2,000 people have died due to opioid overdoses. Now, what gets a lot of attention in the media is the violence on our streets and the murders. But every year for the last several years, twice as many people have died of overdose deaths who have died as a result of violence, who've been murdered. So we really have to focus in on this challenge. And of course, there are many reasons for our substance abuse challenges. Last year in Cook County, 1/2 of the overdose deaths were among African Americans, despite the fact that African Americans make up about 24% of our population. We all know that we need to work together to ensure that those impacted by substance abuse disorder can receive the resources that they need. We especially want to increase our outreach to individuals who are particularly vulnerable. A key part of that outreach must be meeting people where they live and are comfortable, and in a manner that's culturally and personally sensitive. We need to reduce the barriers to receiving treatment, including cost, travel, and the fear of legal repercussions. We want people to know that substance abuse is a disease. It's a disease, just like any other health condition. Recovery is not linear, and support is here. There's no wrong door when it comes to seeking help. Increasing access points like this mobile outreach van is yet another way that Cook County is tackling the opioid crisis. Now, I would like each of our subsequent speakers to introduce the person that follows them. And as I said, Commissioner Monica Gordon has been instrumental in this work, and I'd like her to take the podium next. Commissioner.
Good morning, everyone.
Good morning.
Today we gather to express our deepest gratitude to the heroes amongst us. The individuals who have dedicated themselves to combating one of the most pressing issues of our time, the opioid epidemic that's ravaging our communities. First and foremost, I would like to thank Tony Preckwinkle. I would also like to thank Dr. Nutter, who's here, as well as Jennifer Brothers, my colleagues, Chair of Health and Hospitals, Commissioner Dennis Deere, Ron Velacity of Family Guidance Center, Alderman Ronnie Mosley of the 21st Ward, and I also like to thank the Honorable Deborah Sims. We are here to celebrate a new beginning in the method to combat the alarming opioid crisis in Roseland, Pullman, and other historically under-resourced areas in the far south side and the south suburbs. The Family Guidance Center mobile unit has risen to the occasion with immense dedication, persistence, and determination to solve this devastating issue. They have not only provided essential services, but also have been catalysts for change tirelessly working to reverse the alarming trends of opioid-related deaths that have plagued our neighborhoods. The statistics paint a grim picture of reality we face. During the COVID-19 pandemic, the Southern Cook County area witnessed a staggering 82% increase in opioid overdose deaths compared to previous years. These numbers are not mere statistics. They represent lives lost, families shattered, and communities in turmoil. My family has been affected as well. 17 years ago, I lost my uncle Victor to this troubling epidemic. This crisis has had a chokehold on our communities for far too long. But in the midst of this crisis, this mobile van has emerged as a beacon of hope. Under the leadership of Ron Velocity, Chief Operating Officer of Family Guidance Center, this mobile van has embarked on a mission to provide comprehensive support and intervention to those in need. Their commitment to meeting individuals where they are, both geographically and emotionally, sets them apart as true champions of compassion and empathy. As we reflect on the immense success of the FGC mobile unit, it becomes evident that their work is far from over. The need for continued funding and support for this vital program cannot be overstated. Lives depend on it. Once again, your zip code should not determine your life expectancy. Over the next 3 years, Family Guidance Center plans to distribute over 40,000 overdose prevention kits to residents across Cook County. These kits will not only save lives, but also empower our communities to take control of their health and well-being. I am deeply grateful to my colleagues at Cook County Office of Behavioral Health for their outstanding leadership and providing nearly $1 million to the program over the next 3 years through the Federal American Rescue Plan Act. I would also like to further thank our Cook County Board President, Tony Preckwinkle, my fellow commissioners, Dr. Eric Makaitis, and all those who have supported this critical initiative. Your commitment to public health and safety is a testament to the power of collaboration and community. Together, we have the opportunity to make a difference, to save lives, and to build a brighter future for generations to come. Let us stand united in our resolve to end the scourge of opioid addiction and create a world where every individual has the opportunity to thrive. Thank you so much. And next, I would like to introduce Ronald Velocity, the Chief Operating Officer of Family Guidance Centers.
Thank you, Commissioner Gordon. Thank you, President Preckwinkle. Good morning.
Good morning.
My name is Ron Velocity. I'm the Chief Operating Officer for Family Guidance Centers. On behalf of our President, Dr. Larry Kroll, and our Board of Directors, thank you for an opportunity to speak with you all this morning. Family Guidance Centers is a non-for-profit behavioral health care company with 14 locations across the state of Illinois, 8 of which are located in Cook County. We are a proud recipient of a grant from the Cook County Health under the Federal American Rescue Plan Act. This award is an amazing opportunity for building strong partnerships between Cook County government and community-based providers. I would like to thank Cook County President Tony Preckwinkle, Commissioner Monica Gordon, Commissioner Dennis Deere, and all the commissioners, as well as Dr. Tom Nutter and Jennifer Brothers from Cook County Behavioral Health for all their support in making this award a possibility. Family Guidance Centers received this award to expand mental health and substance use prevention, treatment, and support on the south and west sides of Chicago. We commend the county for their commitment to helping communities address the opioid overdose epidemic that plagues their communities. On January 2nd, FGC unveiled this mobile outreach prevention van, which was made possible through this grant. The mobile unit is now providing much-needed harm reduction supplies such as Narcan, the FDA-approved medication used to reverse opioid overdoses. We're also providing fentanyl test strips and other harm reduction materials, education, and a referral for immediate care into treatment for those individuals on the south and west sides of Chicago. The outreach activity is designed to help address the need for these overdose prevention resources in response to the devastating effects the overdose epidemic has had on Chicago and Cook County. The data from the south and west sides of Chicago is alarming. The significant percentage of opioid overdose deaths in Cook County come from these two geographical areas. The county is commended for providing much needed resources and efforts to focus attention on the south and west sides of Chicago. In the first 2 months of operation with the van, we've seen over 1,700 individuals. We distributed close to 2,000 Narcan kits, close to 2,000 fentanyl test strips, and close to 1,000 other safe consumption use kits. Over 97% of those individuals seen on the van received harm reduction counseling, and 96% actually received a referral for services. The mobile unit is an example of how public and private partnerships can truly work together to offer services to those individuals that are challenged with substance abuse and mental health problems. When this project is complete, we are projecting to see in excess of 20,000 residents and distribute over 40,000 Narcan kits, and we hope to save many, many lives along the way. We look forward to continuing our work with Cook County and all the community organizations on the south and west sides of Chicago. Thank you for all your support. Now I'd like to introduce a good friend of Family Guidance Centers and a good friend of community-based providers across Cook County, the Chief Behavioral Health Officer for Cook County Health, Dr. Thomas Nutter.
Thank you, Ron, and good morning.
Good morning. Good morning.
Thank you to President Preckwinkle, to the Cook County Commissioners, particularly to Commissioner Gordon and to Commissioner Deere, as well as to Dr. Makaitis for their continued support of mental health care, including the care of substance use disorders. We are also appreciative of the Biden-Harris administration making reduction of overdose deaths a high priority, and of the American Rescue Plan dollars that support the project we're here to announce. Use of opioids, particularly fentanyl and the newer synthetic compounds, has now become even more frighteningly lethal, even in small quantities. This is true for first-time users and true for those dealing with chronic addiction. The tragic consequences of our opioid epidemic continue to impact communities across our nation and to devastate families of its victims. Opioids are truly an equal opportunity destroyer. Though the highest number of deaths statewide are among whites, per capita rates in the black population, particularly those in middle age or older, are considerably higher, 8 times higher than the state's average per capita rate. While much of the news has been heartrending, there is reason to believe we can and will do better in 2024. Naloxone, which as Ron mentioned is essentially the antidote medicine for opioid overdose, is now available over the counter, becoming cheaper, and in fact is now free through the state's drug overdose prevention program. Fentanyl test strips and other harm reduction tools are more widely available. Stigma is declining and will continue to decline as we have a better understanding that opioid addiction is not someone else's problem, but impacts our neighbors and our families. And we have new tools and new teams, like the one being announced today. The dedicated, passionate Family Guidance staff, with assistance from the West Side Heroin Task Force and the South Side Heroin Task Force, can now deploy leading-edge harm reduction tools into the areas at highest risk, bringing life-saving tools and life-giving hope to the neighborhoods where they are most needed. Thank you in particular to Mr. Velocity for his next-level collaboration, professionalism, and commitment to come alongside those dealing with opioid addiction. The work is hard. You are inspirational, and we at Cook County Health are proud to partner with you in this life-saving venture. Thank you. And now it's my privilege to introduce a man who I'm understanding whose recovery is iconic. You're an icon of recovery, I understand. Michael Ferguson, Program Manager for Family Guidance Services.
Good morning, everyone. My name is Michael Ferguson. I'm the Program Manager to Harm Reduction, and I stand with you guys today in immense gratitude and excitement about our new program. I'd like to take a moment to introduce myself and share a little bit about my journey, which intertwines profound efficiency of new harm reduction program that we have launched. I used drugs for 16 years of my life. I just recently celebrated 5 years of sobriety back on January 21st. It was a challenging journey, one filled with struggles, hurdles, and moments where it seemed hope was distant. On my journey towards recovery, giving the gift of perspective, understanding the struggles that face those who are still navigating addiction. That's why I am overjoyed and part of this new harm reduction program, which is not my job, it's a purpose. It's an opportunity to give back, to extend the same support and compassion played a critical role in my own recovery journey. I wanted to share a story about the harm reduction van. Last week that we were out on the harm reduction van, we were able to connect somebody in the community that was battling with addiction, feeling lost, isolated. And throughout the efforts, we were able to guide them towards inpatient or residential MAR. Offering a glimmer of hope and chance of transformation, this moment reinforced the vital need for this program in our communities. In closing, I'd like to express the profound gratitude for the opportunity to be a part of this much-needed program. Each person and we connect with every life we touch, and as a step towards building a healthier and supportive community. As I'm thrilled and honored to and stand alongside of you guys towards this journey and making a difference. Once again, I'd like to thank everybody for having me come out and speak. Like I said before, like what Doc said to me, I had a story. There is a story about me in the Chicago Sun-Times. The article was once a homeless drug addict, now an icon helping others. At one point in my life, I was street homeless for about 10 years. And like I said, I just had 5 years clean back in January. Thanks. Thank you again, guys.
All right. Nick, questions?
Any questions in the room?
Commissioner Sims.
Madam President, you mentioned in the beginning of your speech that you'd like to thank President Biden and Congress for the funding for this program. I think everybody's wondering about what President Biden has done as this election is coming close. I think this is one of the things that people can look at and say, he is doing something. He is not in the White House hiding. He's not doing what he's supposed to do. This is something that's really, really important to you, to Commissioner Gordon, to Alderman
Mosley.
For the communities that they represent. So I would like to say we should all be thankful for President Biden and Congress for sending the money to Cook County.
Yes, former Commissioner Sims points out that the resources that we used to fund this program came from the American Rescue Plan Act, ARPA resources. The county got $1 billion. And the challenge was to try to invest that money in ways that would really be supportive of our communities. And a lot of the money, frankly, went to public health. And this is one of the public health initiatives. Dr. Nutter, do you want to speak to that?
We're just incredibly grateful for the...
At the
sorry.
microphone.
Sorry, I'm a little bit of a rookie at this compared to the president. The impact, I've been working as a psychiatrist in the Chicago area for nearly 30 years, and this opportunity that we have over the coming couple of years with the ARPA funds is a generational opportunity to make a huge difference. So we're incredibly grateful for that and want to be good stewards of every dollar.
Yeah. No, the point is we made a tremendous investment in behavioral health services with our ARPA dollars. So.
We're going to have Michael do a demonstration at the van.